few of these business meeting slides. So hello and welcome everyone to our monthly seminar series for UAB chapter of Sigma Xi. We appreciate you joining us today. Just a couple of items of business before we get started here. Thank you for your membership. You can go to the Sigma Xi site to learn more about the value of membership if you're interested in joining. You can reach out to us at sigmaxiuab@gmail.com. And don't forget to renew your membership as well. And reminder about our grants and aid. We're celebrating 100 years of grants and aid for research. The application deadline, the next deadline is March 15th, and funding is for undergraduate and graduate students to aid in completion of research projects. So you can go and find more information about the grants and aid of research following that link there. There's also an upcoming student research showcase that you can find out more about using the link shown on my slide there. And this is a virtual event that runs from April 25th to May 9th, 2022. And don't forget to stay connected to us and hear more about announcements. You would need to be added to our email list. You can also like and follow the UAB Sigma Xi page on Facebook. And you also can email us, and we have a YouTube channel where we post talks. So this talk will actually be available within a couple of days after today on the Sigma Xi UAB YouTube channel. So please reach out to us to nominate speakers. You can do that by sending us an email at sigmaxiuab@gmail.com. And we invite you to nominate speakers and individuals for our monthly seminar series. We welcome diverse scholars in all walks of professional life, including senior and emerging scholars with university appointments, as well as researchers and scholars working in policy think tanks, national associations, school districts, state education agencies, foundations, and higher ed settings. We aim to enhance awareness of underrepresented scholars and their research on and beyond campus, and to promote diverse, equitable, and inclusive scholarly interest and collaborations. So to nominate someone, reach out to us by email and provide your nomination info, including contact information, short summary of why you're nominating the speaker, and details of the nominee's professional background. So we have had, including today, 3 recent seminars. One was Alabama Scholar Strategy Network Op-Ed Writing Workshop, which was in collaboration with the Scholars Strategy Network. And then we had June Ebersole from the McWane Science Center. And now today we have Professor Shauntice Allen, who's been so kind as to join us. I'm going to just briefly introduce Professor Allen, and then I'll hand it over to her for her talk. Shauntice Allen is an assistant professor in the Department of Environmental Health Sciences at the University of Alabama at Birmingham School of Public Health. Her research program has a strong prevention focus at both the individual and community levels, where she explores the inextricable links between environmental exposures and structural determinants of health. Dr. Allen is also an associate scientist at UAB Center for Clinical and Translational Science, where she collaborates with investigators in the disciplines of medicine, nursing, public health, and business, along with the greater Birmingham community. Dr. Allen previously led the community engagement effort for UAB Center for Clinical and Translational Science. She was responsible for development, implementation, and evaluation of the Birmingham Neighborhood Leaders Survey, which is the community-based, community design survey tool used to explore issues affecting health in an urban metropolitan area. Two-time graduate from the University of Alabama in Tuscaloosa with a BS in biology, master's in human and environmental sciences, and PhD in health education and promotion from UAB, Dr. Allen is involved in engaging both urban and rural communities in longitudinal research projects, program evaluation, coalition building, and deployment of community-informed data collection methods. So please put your questions in the Q&A. And our chapter treasurer, Maggie Amsler, will moderate the questions, and we'll pose them to Dr. Allen at the end. So without further ado, I'm going to hand it over. Thank you for being here today with us.
Thank you all so much for having me. I'm so excited to be talking to Sigma Xi this morning. I am going to go ahead and start sharing my screen here so you guys can see that first slide. And if there's a little bit of a delay on your end, just give it a moment to pop up, as some people may have a little bit of delay here. But thank you all again so much for the time and opportunity. What I'm going to be talking about today is race, class, and the politics of place. So I'm going to provide an overview of the environmental justice movement, and then also share with you some things that are happening right here in our own state. So in terms of just a kind of an outline and a roadmap for our conversation, it's always important for us to level set and make sure that you understand what we're talking about and where we're headed. So in terms of discussion aims, I'll be discussing and defining environmental justice. I'll be framing this concepts of vulnerability and exposure. I'm going to talk about North Birmingham, some issues that have happened there, some things that are going on in Fairfield, Alabama, as well as Gadsden, Alabama. So focusing on Alabama, but not specifically Birmingham only. Also talk and explain how air pollution is linked to COVID-19, and then wrap up with some policy-based solutions, and then we'll open it up for Q&A. So there is an official government definition of environmental justice. The Environmental Protection Agency defines environmental justice as the fair treatment and meaningful involvement of all people, regardless of one's race, one's color, one's nationality, your income, and it's fair treatment and meaningful involvement. And that means with respect to the development, the implementation, and enforcement of environmental laws, regulations, and policies. So I want to pause here for a moment and focus on the pieces that I've highlighted or bolded, which is the fair treatment phrase of this, and meaningful involvement. Again, fair treatment is that no group of people should bear a disproportionate share of the negative environmental consequences that results from industrial, government, commercial operations, or any kind of policies at all. And then meaningful involvement, I want to be clear here, it doesn't mean just have a meeting or invite someone to a discussion or to a public comment type hearing event. Meaningful involvement really means that people have the opportunity to participate in decisions about activities that may impact their environment and their health. So the opportunity has to be created for people to be meaningfully involved. It also means that the public's contribution can influence regulatory decision-making. It means that communities' concerns will be considered in the decision-making process. And lastly, meaningful involvement, if we unpack this even further, is that the decision makers actually seek out and facilitate the involvement of those who are potentially impacted or affected by a concern or an exposure. I mentioned that I wanted to talk about exposure in vulnerable communities and kind of frame these concepts around vulnerability and exposure. I'm actually going to change the language here and not use the word vulnerable, but I'm going to use the word, and you'll hear me say this throughout this presentation, I'm going to use the phrase systematically excluded. And the reason why I'm not going to continue to use terms like marginalized, vulnerable, high risk, is that those terms can sometimes be stigmatizing to various groups of folks. They're also very vague. And they sometimes can imply that the condition or the issue is inherent to the group, rather than actual structural and causal factors that impact why someone may be experiencing more environmental exposure than another. So systematically excluded communities are likely to suffer a wide range of environmental burdens, and that includes vehicle exhaust, cigarette smoke, incinerators, coal-fired power plants, wastewater stations, flooding, subpar housing, et cetera. And because of those concerns and those issues, and this is not an exhaustive list at all, they can also be exposed to multiple different effects and health effects, as well as cumulative effects of those different exposures taken together. So for instance, if someone has sickle cell disease or even the trait, they may be more susceptible to the toxic effects of carbon monoxide in their home, or those with diabetes may be less likely to be able to detoxify some type of organic solvent. So when we think about underlying health conditions and where one lives, there definitely is there is a correlation there. But it's apparent upon us as researchers, as students, as scholars, to really begin to unpack what are those multiple individual effects, and then what are those cumulative effects as well, of the different exposures that can have impact on systematically excluded communities, because there are things in place that can cause people to be exposed to some of these things that I have on the slide again: vehicle exhaust, cigarette smoke, etc. I want to talk just for a moment before I kind of dive into some areas of Alabama, of some examples of place-based environmental injustices. On this slide, you'll see Louisiana's Cancer Alley, Emile, Alabama, which is in Sumter County. And then I'm going to just talk briefly about the Dakota Access Pipeline as well. Louisiana's Cancer Alley is one of the most polluted areas in the country. It's a cluster of about 8 to 14 different parishes, and parishes are equated to counties in Louisiana along the Mississippi River, where there are a number of petrochemical plants and chemical refineries. Those are located there. It's also home to a number of like shipping companies. Just you name a heavy industry, you may find it along the Louisiana's Cancer Alley or Chemical Corridor. Emile, Alabama, which is in Sumter County. Sumter County, we're here in Birmingham, or I'm in Birmingham. People may be in other places on the Zoom webinar today, but Sumter County is in the western part of the state. It basically hugs the Alabama-Mississippi line, and it is home to the largest hazardous waste landfill in the country, and it's in our state. Sumter County is about 2 hours away, 2 hours and some change away from Birmingham. And it is, when I say hazardous waste, I'm talking about heavy metals, I'm talking about coal ash, I'm talking about things that can cause different types of cancers, different types of neurological diseases or disorders. And we have a very large landfill in Alabama in Sumter County where a lot of that hazardous waste is housed. And then the Dakota Access Pipeline, as an example of place-based environmental injustice, is an area in kind of the central part of the Midwestern part of the country. It spans 4 states from North Dakota all the way down to Illinois. It actually goes down to Texas, but there's another pipeline that connects to Dakotas. And it carries tar sand oil. Tar sand oil is more thicker, more acidic than regular crude oil, and it can also be more corrosive to the actual pipeline, the pipes that it's running through. The common denominator amongst all of these different places that I'm talking about is the communities where these places are actually housed or sited. Louisiana Cancer Alley is home to a number of Vietnamese, African-American, Latino communities. Emile, Alabama is a very small African-American community in Sumter County. And then the Dakota Access Pipeline, where it actually, where it runs, it hugs up against it, and it actually, in some places, it does touch sacred burial grounds, water sources, or has the ability to pollute water sources that the Sioux tribe very much hold sacred and honor. So to think about, again, communities that oftentimes are systematically excluded and where injustices occur, these are just a few of those examples. Want to give you a little bit of history around the environmental justice movement, and one of its key pivotal events happened in Warren County, North Carolina in the early 80s. So the state of North Carolina had planned to bury about 400,000 cubic yards of soil that was contaminated with polychlorinated biphenyls or PCBs in Warren County. Warren County is a very small county on the upper northern part of North Carolina. It also hugs, it's right on the North Carolina-Virginia state line. And Warren County has an interesting, unique kind of profile to it because it is really impacted by a quadruple whammy. It's mostly African-American, it's poor, it's rural, and there's not a lot of political capital in terms of representation at the state legislative level coming from Warren County. In the early 80s, a number of people protested this landfill that was going to be built in Warren County in order to bury this PCB-laced soil. And these protests led to the first national study that correlated waste facility siting, meaning where they were placed, and demographic characteristics. And that report, that landmark report, was called Toxic Waste and Race. It was published in 1987. And what it found was that race was found to be the most dominant variable in predicting where facilities were located. And this variable, race, was more powerful than poverty, more powerful than land values, more powerful than home ownership, and that people of color are oftentimes found to be more concentrated around hazardous waste facilities than previously shown. So the advocacy work of individuals in Warren County led to a national report that was based on data. And this was the first time that this had actually happened, looking at waste facility sites and demographic characteristics. So this was a really important piece of work in terms of bringing the science to the environmental justice movement, the research aspect of this. Speaking of that, some colleagues and I, we wrote a paper in 2019, and I'm going to move us to North Birmingham here. Now, we wrote a paper about the search for environmental justice, the story of North Birmingham. And essentially what this article really highlights and spotlights is the history of the North Birmingham community. If you didn't know this, North Birmingham was actually a city before Birmingham was a city. It was incorporated into the city of Birmingham in the early 1910s or 20s. But it had its own police department. It had its own country club. It had a number of amenities in this part of the city that we now know as North Birmingham, but North Birmingham was here first. This paper also was centered around identifying the responsible parties named for the contamination in North Birmingham. We wanted to highlight the government's involvement in this as well, because one of the things in the environmental justice movement that is still a source of contention is how do powerful decision makers play into either seeing justice served or done or injustices continued. And then we also wanted to share the community's response to this injustice as well. So just wanted to encourage people to check out that article. This is a 1926 North Birmingham redlined map. And if you don't know what redlining is really a discriminatory practice in which services, largely financial services, are withheld from potential customers who reside in neighborhoods that may be classified as hazardous to investment. And so these residents largely, oftentimes, belong to racial and ethnic minorities. And as you can see what's circled here, that area, that red area, is North Birmingham. And it's surrounded by a number of industrial facilities, including steel mills, coking plants, pipe manufacturing facilities, rock quarries, recycling facilities. There are a number of places that emit a number of hazardous and often very dangerous pollutants into the air, and unfortunately are concentrated in an area where you have a large number of racial and ethnic minorities. And so I'm sharing this with you because the politics, and there's a system, and it has been a system in place for a very long time, to exclude individuals from living in certain places. So place matters. Where one lives does have impact on health outcomes. And again, this is from 1926 that I'm showing you, but we're having this discussion in 2022, and there's still a number of concerns in North Birmingham around air pollution. So what do we know about North Birmingham? North Birmingham has an EPA Superfund program. Although the Environmental Protection Agency Superfund program can begin cleanup of a site or begin to kind of implement removal actions when levels of contaminants are high or are of immediate threat. The long-term funds, the long-term recovery and opportunity is really only available to Superfund sites when they're listed on the national priorities list. The North Birmingham, the 35th Avenue Superfund site, which is the name of the site in North Birmingham, it runs along 35th Avenue, is not on the national priorities list. And there are ways that a site can be proposed for that list. One is that a site assessment has to result in a hazardous ranking score of 28.5 or higher. Two, the site is designated by the state or territory as a high priority for cleanup. Or three, the Agency for Toxic Substances and Disease Registry has issued a health advisory for that site. Now, I mentioned this hazardous ranking score of 28.5. The 35th Avenue Superfund site, its hazardous ranking score when EPA did its assessment was a 50. Yet it is still not on the national priorities listing. So that in itself is an injustice because we have criteria in place to be followed, but it's not being implemented here. And so there have been community members that have been very much involved in identifying what does success look like in terms of cleanup efforts in North Birmingham or revitalization efforts. And I hesitate to use the word revitalization because it makes it sound as though something is being revived because it died. There has been very much a tremendous amount of advocacy work going on in North Birmingham for decades. So I don't even know if I want to say revitalization efforts, I'll say cleanup in this instance. But the community has identified environmental cleanup and restoration as a priority, pollution reduction and prevention as another, and then multi-generational engagement and involvement. So back to that original definition of environmental justice, this whole notion of being involved over multi-generations is very important to residents of North Birmingham. And North Birmingham, again, is made up of 6 different neighborhoods that comprises the North Birmingham community. Just wanted to showcase some of the instrumental folks who are working on these issues in North Birmingham. The woman who's in the gray in the hat, Catherine Evans, is president of the Sipco Findlay Neighborhood Association, and I did have permission to use their photos here. She's standing in front of Jordan Industrial Services, which is a recycling facility right on Findlay Boulevard. If you've ever been down Findlay Boulevard, or if you know where the Alabama Farmers Market is, it's directly across the street from the farmers market, which is interesting that a recycling facility that's polluting the air is across from a place that's supposed to be providing fresh fruits and vegetables to people. But she protested the business license of this company for the metal recycling business, and she's rallying residents on a regular basis to battle pollution in her neighborhood. And then Keisha Brown, who is on the right, in the orange, she lives in Harriman Park, which is one of those 6 neighborhoods that comprises the North Birmingham community, is a firehouse. She has spoken before EPA in Washington. She has gone to Montgomery a number of times to talk with the Alabama Department of Environmental Management about health issues that she and others in her community are concerned about. So these women are keepers of data and of information, of stories, of narratives that are very important in the entire work of the environmental justice movement. I mentioned earlier in my discussion points that I wanted to talk about Fairfield. Fairfield is home to U.S. Steel Fairfield Works, and it's a company town. So it essentially means that, you know, a number of people who live in Fairfield at one point in time worked for U.S. Steel. It was also is home to the now closed Lloyd Nolan Hospital, which was actually built for those individuals who worked for U.S. Steel. But there is an organization that is emerging in Fairfield called the Fairfield Environmental Justice Alliance. And they have been actively working to oppose and bring awareness to an electric arc furnace that's being fired up now at U.S. Steel. And they have some concerns about this technology, as well as just their own health concerns that they have had for some time. So they have been very, very organized and very intentional about how they have been working to address the issues at U.S. Steel. And they've been attending public comment hearings. They've been working with organizations in order to document their concerns. Documentation is really important in this work and it's really important to be able to visually show what's happening as well. So the Fairfield Environmental Justice Alliance is a group to certainly keep your eye on. I won't show this clip, but if I'm sharing the slides with the group later or the presentation, I encourage you to watch. This is a 6-minute clip that CBS 42 did last year, asking residents about what's in their air and also talking with health officials about how air monitoring is happening in the area. So I'd encourage you to take a peek at that too. I want to talk a little bit about air pollution and particulate matter in the county. This chart or this graph is showing essentially Jefferson County's particulate matter versus Alabama versus the US. So the line on the top, the red line, is Jefferson County, and this is 2021 county health ranking information, which comes from CDC, but Robert Wood Johnson is reporting on this. So Jefferson County, as you can see, I'm not sure what was going on in 2005, probably through saying a little bit of a drop in 2008, and then some additional decline. But you can see that Jefferson County certainly has a particulate matter issue in terms of average density of fine particulate matter across the county over those years that you see represented here, as compared to the state and as compared to the US. And there's a relationship between elevated air pollution, particularly fine particulate matter, PM 2.5 or PM 10, and compromised health concerns. And some of those include decreased lung function, chronic bronchitis, asthma, and some other pulmonary, adverse pulmonary effects. Going to move us on to Gadsden here for a moment. Gadsden, Alabama is located in Etowah County. It's about 60 miles northeast of Birmingham and about 90 miles southwest of Chattanooga, Tennessee. It is located on the Coosa River, and residents in Gadsden recently have successfully fought off Pilgrim Pride's poultry rendering plant construction. This rendering plant would have extracted essentially protein from chicken parts. So basically what's left over after you have processed a chicken, the feathers, the bones, all of these things kind of gets cooked up, and it's used in a number of other types of products. And they wanted to build a poultry rendering plant near the airport in Gadsden. Gadsden is also home to 7 Alabama Power dams that are on the Coosa River. So the Coosa River is actually not a free-flowing river on its own. It's actually a series of lakes that have been dammed. The river has been dammed over time to create these various lakes. And another issue in Gadsden is coal ash contamination from utility plants. And this is an ongoing concern along the Coosa River. And when we start talking about water quality and this in its relationship to communities that are oftentimes systematically excluded or those who have already existing underlying health concerns, putting yet another heavy industry or polluting industry in an area that already has enough or has plenty is an issue. And one of these things, again, coal ash, and I'll talk about that in a little bit more in a minute, has been an ongoing concern in the Gadsden area. So this is some information taken from Coosa River Keeper. I love this graphic and this visual. It says, we did the math. Plant Gadsden's coal ash pond is larger than 12 Bryant-Denny stadiums put together. So if you look at the total acreage of the coal ash disposal area here in this photo, you'll see that it says here it's 274.8 acres, and 12 Bryant-Denny stadiums is 22 acres. So this coal ash disposal area, which oftentimes isn't lined, meaning that there's an aligning at the bottom of the disposal area, it can leak and seep into local water sources. And in this particular instance, we're talking about the Coosa River. A lot of sites across the country where coal ash is being discharged into water sources, the solution is to cap in place. And that does not necessarily work. It can worsen the pollution, and coal ash pits can spill. If there's heavy flooding in the area, if there's a heavy rain, it can cause a lot of leakage and spillover into places. And the Gadsden power steam plant in Gadsden or in Etowah County is jointly owned by Alabama Power and Georgia Power. It burns coal and natural gas, which there are going to be emissions from that. And coal ash is the byproduct of burning coal. It's used, and coal is used in coke making, which is an industry here in Birmingham. But interestingly enough, coal ash is not classified by the EPA as a hazardous waste. But the concentration of heavy metals in coal ash is actually more potent than the original coal itself. So I think that's very interesting that it's not considered to be a hazardous waste product, but yet actually what's produced and what's in coal ash can have much more detrimental effect than the original coal itself. This coal ash disposal area is 4 miles upstream from a drinking water intake in Shelby County. And as I mentioned, there are a number of coal plants that are next to waterways across the state, with Gadsden being one of those places where the Miller site is. Let's keep this going here so we can get to some Q&A. So I want to talk about air pollution and COVID just for a moment here. Exposure to high levels of air pollution really has repeatedly been linked to vulnerability to COVID-19. There was a Harvard study that was done in November of 2020 that found air pollution linked to higher COVID-19 deaths. And people who lived in areas where levels of PM 2.5 are 15% more likely to die from coronavirus than someone in a region with one less unit of PM 2.5. So essentially what this paper said was, if there had been a decision to reduce the amount of PM 2.5 by 1 microgram by cubic meter, there would have been 300 less deaths of COVID-19. This was in New York. They were specifically focused on New York City here. There would have been 300 less people to die from COVID-19 by reduction of the PM 2.5 level by 1 unit. And so that's a decision here. We're talking about regulations. We're talking about people being on their P's and Q's and ensuring that folks are living in areas where PM 2.5 in terms of levels of it being emitted are not exacerbated. But again, people who live in areas where there's high concentration of heavy industry are oftentimes impacted by that. And we saw and we know that toxic living conditions and environmental racism does inflate death rates among Blacks, even before COVID-19 struck. We know there's inequitable distribution of hazardous waste sites. I've talked about that earlier, such as landfills and others that have been a longstanding concern of environmental justice activists and researchers. And poor environmental conditions and protections, they cannot be separated from racial inequity or the COVID-19 epidemic. Air pollution and COVID-19 are important in a couple of ways here. And air pollution is important to COVID-19 because higher death rates can occur due to lung and hearts that are weakened by dirty air. Pollutants can inflame lungs, potentially contracting the virus, making that more likely for it to happen, and raising concern about rising pollution levels even after lockdowns were lifted. When we were all at home and stay-at-home orders were in place, we saw decreased levels of air pollution because people were at home. But when folks started to come back out, there didn't seem to be really a plan in place in order to continue to keep people healthy, particularly those who live in heavy polluted areas. And particles of pollution may even help carry the virus even further. And again, this is what we knew at the time. This is back, and I'm thinking about this back when the virus first hit in early spring of 2020. This is just a graphic from CDC that talks about the impact of climate change on human health. And I think it's important to have a conversation in the context of climate change and health outcomes, because there are so many things that climate change impacts. And this slide essentially just illustrates the most significant climate change impacts. So rising temperatures, more extreme weather, rising sea levels, rising carbon dioxide levels, those have impact on nutrition, on heat-related illnesses, on mental health, on cardiovascular disease. And so some of these subsequent, asthma, respiratory concerns, some of these subsequent health outcomes really do link to climate. And it's important to have that conversation to understand what those linkages are, to study this, and then hopefully to make informed decisions about how we address and how we equitably address issues, particularly for those who live in areas where where it's very hot, or where there is environmental degradation happening on a regular basis. This is an important conversation to have. So, how do we move forward? I talk about this a lot in my class. I think my students are like, gosh, we talk about a lot of things that are not good. What are things that are good? How do we move this forward? How do we move this work forward and this conversation forward? And I think a couple of things have to happen. First of all, we have to acknowledge that race, class, and environmental injustice are intricately linked. They are not separate from each other. You can't have a conversation without the other. I think it's important that our study designs, the way we ask research questions, how we think about this work, we really need to be thinking about it holistically and systematically. I think it's also important to recognize the unique and profound social and environmental challenges that are faced by systemically excluded communities. It's not enough just to state that a community is a community of color, or it is a community of low wealth. It is important to recognize what are those unique and profound social and environmental challenges that those communities face. And not just to recognize them, but to recognize them, to acknowledge them, and then help to change them as well. I think another way forward is developing culturally responsive social indicators to assess and monitor the quality of life for those that are most impacted by environmental destructive or unstable environments. So for instance, there has been if you've been paying any attention at all to what's been happening in the world, there has been an increased number of suicides over these last few years, particularly, and we need to understand what that means. But if we're thinking about how do we create interventions around this issue, and I'm just using suicide as an example, thinking about that with an Indigenous population or an Indigenous people is different. So Indigenous suicide is associated with cultural and community disruptions. It's associated with cultural loss. So, but we're oftentimes think about suicide from a very clinical perspective or lens, or an individually focused manner. And so to develop measures to be able to intervene has to look differently with, again, I'm just using this as an example, with an Indigenous group than someone else. So it's important that that as researchers, that as practitioners, as students and others who are on this webinar, that we're very cognizant about how this work is done in a culturally responsive manner. Another way forward is to ensure the right of all people to be meaningfully participating in decision-making on environmental and health issues. Back to my original definition of the EPA's definition of environmental justice, it's not enough just to have somebody at a table. It is important that their voice is heard, that their contribution is actually implemented, that people don't feel as though they're there just to check a box, but that there's real, authentic, meaningful participation in decision-making, and those decisions being implemented in a culturally responsive way. And then lastly, I think it's important to establish programs to protect people from environmental racism that could be caused by government and industrial activities. So just the rules and regulations that we have in place, they need to be followed. One of the things that happens in environmental justice communities, oftentimes there's a lot of delay in cleanup. We're seeing this in North Birmingham, and it typically happens in communities of color. So there may be cleanup, there may be an environmental hazard or something that has happened in another community that is of high wealth or high resource, and it's oftentimes a quick cleanup. But you don't see that in other communities, but it's like, well, why not? You know, what's that about? So I think it's important to really to establish processes and programs to protect people from those kinds of things in the first place. So what can those of you all who are on the webinar do to support environmental justice communities? I would encourage you to follow the work and follow groups that are working on environmental justice issues. EJ is the short term for environmental justice. So GASP is one of those organizations, which is the Greater Birmingham Alliance to Stop Pollution. It's an air quality environmental justice group. They are doing a phenomenal work. I would encourage you to follow them on social media. If you can support their events that they're having when it's safe to do so, please do. PANIC is another. It's the People Against Neighborhood Industrial Contamination. It's a grassroots organization that's based out of North Birmingham. They are very instrumental in having conversations with residents about what's next. How do we continue to move this work forward? What's going to work best for us here in North Birmingham? Another phenomenal group to work with and to follow. I mentioned the FASIA, the Fairfield Environmental and Justice Alliance. They're up and coming, and again, I do believe that they have some social media presence, and that media piece that I had the link to earlier back in a slide, I encourage you to watch that because it really focuses on this effort. Follow these riverkeeper organizations, volunteer with them when they have cleanup opportunities. You know, just be informed about the work through reading, following what they're doing. Again, through some of these mediums, news stories, social media, you know, public hearing opportunities, etc., reading books. And before I wrap up, I have a few book recommendations that I'd like to share with those who are on the call. If you are interested at all in how the US government has been unfortunately complicit in perpetuating some environmental justice issues, I would encourage you to read Richard Rothstein's book, The Color of Law. It is a phenomenal read, really and truly about how policy has been implemented in order to keep various communities in place and excluded from various opportunities. It's quite the read. Power, Justice, and the Environment is actually, it's more of a textbook. It's a book that I often refer to in my own work. So it's more of a resource piece, but it really kind of looks at kind of the overview, progress, success of the environmental justice movement. And then lastly is Cast by Isabel Wilkerson. She also wrote The Warmth of Other Suns. It really looks at society-wide systems around social stratification. If you're interested in this whole notion of kind of inclusiveness versus exclusiveness, I would encourage you to read this book. It's a little bit of a hard read, not hard in terms of what she's saying, but it's an emotional read. But I would encourage folks to check out all of these. I like to give book recommendations and talks. And then these are just some of the resources that I use for today's conversation. Again, happy to take any questions now at this time. And I thank you all for your time and attention. And I'll stop sharing my screen if that's okay, so I can see others.
I just want to thank Professor Allen for an incredible talk. Do we have any questions from the Q&A?
Not right now, folks. Please go ahead.
I have one if there isn't one already there. Oh, sorry, I didn't mean. Sorry, Maggie. So there aren't any in the Q&A yet. I think people are probably typing.
Okay.
So I have one. You talked about this really powerful work that's being done by Catherine Evans and Keisha Brown, as well as some environmental justice organizations. And especially, I think you mentioned in terms of like data collection as well, right? And one thing that I was thinking about is that a lot of these environmental injustices seem like something that's easier to do when the data is obscured. And I was wondering, what are there resources available for people in communities where these injustices are being perpetuated, where they can go to those resources and learn through data about what's going on in their neighborhood, right? And maybe see what pollutants are impacting them locally.
Yes, so there is an air monitoring. There are air monitors across the county, and I'm specifically talking about Birmingham now. And one can go to the health department's website to look to see what air quality looks like on a daily basis. Now, it's not going to necessarily tell you like at your house, this is what this is. It's like the weather report, it kind of gives you like, this is what's forecasted or what we're looking at right now at this time. So that's definitely a source of information for in terms of air quality in one's area. Now, there are other things that are out there. I don't know if people will want to read a bunch of journal articles versus clicking on something that kind of shows you a red, yellow, green type indicator, but that's certainly one. But I think what's important in this work is understanding, because there's no way to really measure this without just talking to people. If someone you need to know if someone is having problems with respiratory concerns and they can't cut their grass that day. That's not something that's going to be, that's not a checkoff type of thing. So we're talking about, if you want to try to dig into quality of life types of issues, that's going to require that interaction with community, that participation, that meaningful involvement piece. But to answer your question very quickly, just one quick source would be the air monitoring indicator that the health department
sounds like
it produces every day. Yeah.
I wish there was like, even for carcinogens, there was a map, like how we have COVID-19 case maps or something like that.
It's so interesting because, again, I mean, COVID is something you can't see. We take for granted that our air is clean or we think it is, and it's not always the case. And a lot of times you don't really know what's going on until there is a symptom to you feel some type of way. If there's an asthmatic episode with your child, then that you typically may not have seen before at a particular season or whatever, then that's something to think about. But it's not it's not something that's just constantly, I don't know, people just, we don't think about the air because we think we take it for granted that it's always there.
Makes so much sense. Yeah, you can kind of push it to the back of your mind,
Yeah.
and then until a crisis.
Right.
Well, maybe that'll be one of the
Thank you
silver
so much.
linings of COVID, is that it's heightened everyone's awareness
That's true.
of how
Yeah.
more susceptible, vulnerable to disease one can be.
Yeah.
In such areas.
Yeah, it does.
Yeah.
But it all really boils down to politics, doesn't it?
It does. It boils down to systems and how we create and craft them and how we move within them. And unfortunately, there have been folks who have been very much disproportionately and detrimentally impacted by systems that they've worked fine for some folks, but they haven't worked fine for others.
Right.
Yeah.
Right. This is such a contrast to a lecture I attended yesterday on the landscape architect, architect Philip Law Olmsted, who was kind of a man ahead of his time with the DEI. Parks are for everyone. There should be a park in every area of the city. And I think he had some statistic like within a 4-minute walk of anyone's home, they should be able to go to a park.
Mm-hmm. Have you heard of a 15-minute city?
No.
Where there's this concept of a 15-minute city where there should be every amenity that one needs should be within 15 minutes of either walking or some kind of public transportation or whatever. That's hard in a rural community. That would be challenging in an area where you don't have good mass transit.
Of course.
Yeah. So, but anywho, there's this notion of a 15-minute city is kind of the ideal place to live because everything is within 15 minutes of, being accessible, which would be great.
Mm-hmm. Let's see, I see there might be another.
So it sounds like you, Dr. Allen, should maybe do a quick op-ed, maybe focusing on your last couple slides where people can go to follow.
Yeah.
So many
I
of
do
these
see a question.
issues.
I'm sorry. It says, are there efforts at trying to coordinate the many groups that might share interests for EJ issues at a broader level? So there is a statewide a regional riverkeeper organization, and then there's also a national riverkeeper organization as well. GASP is involved in a number of regional efforts, but I don't know if there are so there are some things that are happening countywide, that are happening statewide, and are happening in the Southeast. But keep in mind, these are communities that have their own unique nuances as well. They certainly share best practices and lessons learned, which is important, but being able to customize some of those initiatives is important too. So there definitely there's some coordination that's happening, which is good. Because we don't want people working in silos when there's opportunity to share information and ways of doing things. So thank you, Pete, for that question.
Let's see, do we have any other questions in the Q&A? Is it the chat?
Or the chat. Yeah.
I'll ask. I don't think I may have missed. I don't think you mentioned lead in the air and in the soil. It's ever pervasive. It's everywhere. The Department of Health used to monitor it or filter for it, and I don't know if they still are or not. But it's amazing how much is out there. And
it is amazing.
Is anybody looking at lead related, higher concentrations of lead related to environmental justice in the areas that it affects?
I don't know if if there is, I mean, you're right, the health department has been doing some of that work. I'm not sure exactly if there's kind of a consistent lead monitoring program now. And that really was focused on kids too, because they have a tendency to put everything in their mouths. And oftentimes we see more concentration of lead levels in blood in kids. And there's some research that definitely is happening across campus around that, but I don't know if the health department is doing that right now. There was a organization, it was a nonprofit organization in, I don't know if it's in Birmingham, that was focused on lead exposure in children. This has a pediatric focus to it from what I know. So I don't know the answer to your question if that's ongoing now, but there have been efforts in the past around lead exposure. Now, any exposure to lead is not good. We don't want anybody to be exposed to lead. And I think EPA just recently put out some new criteria around lead exposure, essentially saying that it's all bad, and we need to do better about that, particularly in areas where there's heavy metals coming out of some of these plants that are emitting that are emitting everything. How do we better monitor that? Number one, because a lot of times these companies are reporting their own emissions levels. It's not being done by the Alabama Department of Environmental Management or EPA. EPA sets the criteria, but the actual companies report themselves. So they can tell you anything.
So just as an aside, several years ago, my son did a simple science project on air pollution in Birmingham. So I decided to take him by the health department, and a person there who's one of the people that goes out and goes out to the different locations where the health department has the monitoring stations, and showed us the different things they were filtering out. And then she said, I want to take you to one that's right beside the interstate over near the Tallapoosa Street exit. And it was there for many years. And so we stopped there and we walked up to one of the filtering things that had, like an upside down funnel on the top. And she opened the lid and there was a piece of white filter paper. And in the middle of it was about a 10-inch in diameter, beautiful silver circle. And she said, that's lead in the air.
Lead in there, yeah.
And she said, every time an 18-wheel truck went by on the interstate right there, it was stirring up lead that's in the soil.
Yeah.
And that gets into the air. And
Yeah.
so that really drove home to me that it's everywhere. And even if we're not disturbing the dirt in our garden, it's actually getting into the atmosphere and is in what we are breathing. So that's why I asked, some about.
Yeah.
And so I don't know whether they're still doing that kind of monitoring, but it was very interesting. And that was not near any industrial sites. That was right by the interstate.
Mm-hmm. That's interesting, because I think the greatest achievement that we've had in terms of decreasing lead levels was omitting lead from gasoline in the 70s. So we would be in even more trouble now if we still had lead in gas. But, thinking about what you just mentioned, 18-wheelers, they're using diesel in these trucks. They may be, and there's still places, obviously, that are emitting lead pollutants or pollution of lead from the type of business that they do. One of those places is that recycling place that I was talking about, that Catherine Evans has been fighting the business license against as well. But that's interesting. Yeah, we need more monitoring. We need more information to understand how to make better decisions. So I completely agree that however we can make that happen, I think it's important. Again, following the work, understanding what's going on is important.
Dr. Allen, a follow-up here on the lead from Beth Stewart of the Cahaba River Society. which is right now involved in a deep dive to understand water equity issues in and out of, I love this term, the people shed, which includes Jefferson, Shelby, Bibb, Perry, and Dallas County. She would really appreciate knowing how the Cahaba River Society can make a difference, and that they're also concerned about lead in drinking water in addition to air quality. And is there federal money coming to replace those service lines, and or is there enough information needed at this point to access and target those funds?
There's probably more information that's needed. I am not familiar with the lead service lines with Cahaba River. I'm looking at the piece in the chat too. There is EPA, interestingly enough, the new administrator, Michael Regan, is very, very, very focused on environmental justice issues with air, water, and soil. And so I would certainly think that there would be, if there isn't kind of set funds now, that those would be coming down the pipe. I think it would be important for Cahaba River Society to just be watching what's coming out of the lead conversation around water quality, particularly in our region, in Region 4, in EPA Region 4, because they have there's focus for various things in different regions. And we definitely have some water concerns in Alabama. So I would just encourage the River Society and those who are associated with it to continue to watch what's coming from EPA, because it's been amazing to see the kinds of funding announcements and opportunities that have come across my inbox that have been very focused on justice, with emphasis on whatever it might be, water, etc. But I do think it would be important for you all to have the information that you need. I don't know if there's monitoring work or if there's any kind of what's happening with Cahaba River in terms of monitoring lead in the water. I would imagine that they are doing some water testing on a regular with Cahaba River, but I don't have that data to know.
Right. Thank you. Lots of questions.
Yeah.
Okay, so
see
Beth's
another
response,
comment.
there are lead service line replacement funds approved in the
Okay.
infrastructure bill
Okay.
that will flow through ADEM, presumably. We're concerned about household drinking water lead.
Okay. Yeah.
in Birmingham.
Yeah. That's an issue, and it's not only that's not a Birmingham only issue. Too, there is concern. I think we were talking briefly before the webinar started about Catherine Flowers, who's doing work in Lowndes County. There's concern about straight piping of water out of people's homes, and they're not being or limited access to clean water or appropriate sewage disposal there. There's some, I would encourage this person who's commenting, keep watching what's going on with that infrastructure bill. And then, I mean, advocating for some of those funds to be utilized for household lead drinking concerns. Yeah. I'm sorry, I'm talking and I'm watching the chat.
Right.
Yeah, good comments. They're really
I'm
interesting.
listening and
Yeah.
watching. Yes, it is a
Yeah.
big problem, especially in Dallas County and Uniontown, which do indeed
Yes.
have lead in household drinking water. And of course, it's impacting childhood health.
Yeah, and so what the Uniontown issue is, there's a big landfill there called Arrowhead Landfill that is accepting coal ash and basically hazardous waste from 33 other states in the country. And when the wind blows, when it rains, whatever, because it's not a covered landfill either. They're not capping anything in place. It's just kind of being dumped in there, and then whatever happens, happens. So I can definitely see why Uniontown is having issues with lead, because there is lead and mercury and arsenic and cadmium and other things in coal ash. And if it's being blown around, there's certainly opportunity for there to be impact with the water. Wow. We need some funds to do some good things.
Yeah.
Definitely.
I mean, when I think about the infrastructure bill, I think, about, you hear about crumbling bridges and things like that, but also we need to modernize to make disposal of chemicals and whatnot safer.
Safer. Yep.
That technology is plays a role.
Exactly.
It's really interesting.
Exactly. I agree.
We have any other questions? For
None that
Professor
are
Allen?
popping up.
Okay, well, if not, then I just want to thank Professor Allen for being here with us today and taking time out of your schedule for this incredible talk. We appreciate it so much.
Thank you.
And thank you for introducing us to it as well as your
Yeah.
students.
Oh,
Yeah.
The students
absolutely.
are going to be the future, right?
Yeah.
That's correct. That is correct. Well, I
right.
thank you all for your time and what Sigma's Eye is doing with these various talks. This is fantastic. I actually watched a few of the previous recordings before, before I
Wonderful.
came. So I'm glad that you all are making those available to folks. That's good.
We appreciate it so much. All right, thanks everyone.
All right.
Everyone has a great rest of their day.
You too. Take
Thank
care.
you.
Stay
Be careful
safe.
with the weather today.
That's right.
Yeah.
All right. Bye-bye.
Bye-bye.